Hello, my name is Cassidy and I'm going to be your student nurse today. Today I'm going to be performing an abdominal assessment on you. Is that okay?
Yeah.
Okay. So I'm going to perform hand hygiene and clean off my stethoscope. So first I'm just going to start by asking you a couple questions. Do you have any abdominal pain?
No.
Okay. And are you having trouble going to the bathroom?
No.
Okay, good. So first I'm going to start by looking at your stomach. Is it okay if I lift up your shirt?
Yeah.
Alright, so I'm going to start by inspecting the abdomen. I'm looking at the overall shape and contour of the abdomen. It appears to be normal. I'm looking to see if there are any pulsating masses, which would be an abnormal finding. I don't see any of that. I'm looking for any signs of trauma, any bruises, any lesions, which I don't see. Everything appears to be normal. Moving on to auscultation, I'm going to listen to the arteries. So I'm going to start with the aorta. As I listen, I'm listening for any turbulent blood flow or bruits that could indicate an aneurysm. I'm going to start by listening with the diaphragm. It's the aorta. I hear the normal bowel sounds, which is normal, and in the distance I hear a pulse, which is also normal, but I do not hear any turbulent blood flow or bruits. Next I'm going to listen with the bell. Again, I hear the same thing. I don't hear a bruit. Next, moving on to the right iliac artery. I'm listening for the same thing. I do not hear a bruit. Moving on to the left iliac artery. Again, no bruit. I'm just going to go ahead and listen with the bell too. You may be able to hear vascular sounds better with the bell. But again, I don't hear anything abnormal. Next, I'm going to listen to the femoral arteries, first starting with the right femoral artery. Is it okay if I just pull your shorts down a bit? Again, I don't hear a bruit on either side. Everything is normal. Next, moving on, I'm going to listen to the abdominal sounds. I'm going to start in the right lower quadrant and work my way clockwise. Once I hear a bowel sound, I'm going to move on to the next quadrant. Okay. I heard a bowel sound pretty quickly in that one. I'm going to move on. I heard a bowel sound and I just waited a few seconds, listened for a little longer. Move on. Okay, I hear a bowel sound. The last quadrant. I hear a bowel sound. So her bowel sounds were normal active. They weren't super slow or super fast. Normal would be about 5 to 30 sounds per minute, which I heard, and everything is normal. Next, I'm going to move on to percussion. So I'm just going to percuss the abdomen. It should be a tympanic sound. I shouldn't really hear any dullness. That could indicate maybe like a mass or constipation. So I'm just going to lightly tap. Tympanic. Tympanic. And I heard tympanic in all 4 quadrants. That's normal. Lastly, I'm going to move on to light palpation. So I'm going to palpate your abdomen, and I want you to let me know if you feel any tenderness. that hurt?
No.
Okay. Didn't feel anything unusual, and my patient reported no tenderness, so everything appears to be normal. And that is the end of my abdominal assessment.